Thank you, Attorney General Blanche, and thank you to the White House Fraud Task Force, to Colin McDonald of the Justice Department, to Director Kash Patel of the FBI, to the HHS Office of Inspector General, Dr. Oz and the CMS team, and the investigators and law enforcement officers who brought these cases forward. President Trump directed this administration to confront healthcare fraud aggressively, and we are doing that. The 2026 National Healthcare Fraud Takedown uncovered $6.5 billion in alleged fraud, the second largest amount ever charged in a single healthcare fraud operation. The Department of Justice charged a record number of Medicaid fraud defendants. More than 440 defendants now face charges. This effort brought together federal agencies, state partners, and U.S. territories across the United States. 18 of the participating states, as Attorney General Blanche pointed out, were blue states with Democratic governors. Fraud does not recognize party lines, and neither does accountability. Today's cases include the largest Medicaid fraud enforcement action in the Department of history, 165 defendants charged with allegedly submitting more than $200 million in false claims to Medicaid. These schemes did not target government programs, they targeted the American taxpayer. They stole money from workers who pay taxes, from families who depend on Medicare and Medicaid, and from patients who trusted their healthcare professionals to be serving their health interests when it turns out they were just chasing money from our agencies. The allegations in these cases are particularly disturbing. Some defendants allegedly ordered medically unnecessary tests. Others prescribed products that patients did not need. Some allegedly fueled opioid addiction to increase their own revenue. In certain cases, patients allegedly died while believing they were receiving legitimate medical care from providers who only viewed them as billing opportunities. These defendants did not simply break the law, they violated the trust that patients place in medical professionals. One of today's indictments charged a hospice owner in Los Angeles area and two marketers in a $27.7 million Medicare fraud scheme. According to the indictment, the owner paid illegal kickbacks to obtain personal information of deceased Medicare beneficiaries. One of the ways that Colin and Dr. Oz have been chasing down hospice fraud, we've closed now 800 hospices in LA. And one of the ways that we've been able to detect that fraud is that in many of them, the patients never die. They live forever. That's not supposed to happen in hospices. And this particular owner was actually going out and purchasing names from coroners of dead patients and then billing us for those, to make it appear that some of his patients were actually finally dying. And while taxpayers funded these false claims, the owner purchased a Rolls-Royce Phantom. That case illustrates exactly what is at stake. Every fraudulent dollar diverted into a criminal scheme is a dollar unavailable for patient care, for medical innovation, or for services for vulnerable Americans. During the Biden administration, my predecessor implemented two reforms at HHS. One of those was a so-called pay and chase system. We know when invoices come into my agency, we can tell that some of them are fraudulent or probably fraudulent. And the new system said, we're not going to stop those payments. We want everybody paid, and then we'll claw them back at the end. It was called pay and chase. And when I asked people, the careers at HHS, how could you do this? This is crazy, because of course we never claw back anything. They said that they were told to focus on enrollment and not fraud. The other thing that they did is to liquidate our program integrity office.